Hello friends, this is Dr. Gay. I just wanted to say a few brief words about the coronavirus situation. The first is that it is likely that many people have already had it and didn't know they had it and it wasn't that bad. Or they may have thought they had an unusually bad respiratory infection, but they got over it. The thing that we are concerned about with the virus is that it is extremely contagious and spreads so fast. It's not that it's the most dangerous disease in the world, it's that if everybody gets it at once, then the people who do get very sick could possibly overwhelm our healthcare system. You know, there's only so many respirators and so on. But this happens with every kind of viral illness on a seasonal basis. And we have had pandemics in the past, such as the H1N1, swine flu, SARS, and so on. And we didn't have this kind of response, but the speed of this particular virus makes it of concern for the country's ability to handle it. So I'm not going to go over the sanitary precautions because I'm sure you've all heard them, and if you haven't, everybody from the president to the Pope has told us to wash our hands. So take care of that part. What I want to do is explain it a little bit. The virus comes in, as viruses generally do, respiratory viruses, and they land on your mucous membranes. If you can prevent that from happening, you're not going to get it. But once you are exposed, the viruses will land on the membranes in your nose, mouth, respiratory system, and they will start hijacking your own cells in order to replicate more viruses. In each step of the way, the virus takes a strategy, you might say, that tends to distract or fool your immune system and make it harder to get rid of it. Eventually, your immune system figures it out and wins the day, usually. So we want to help our immune systems win the day. A word about the immune system in general. Most of us think of vaccines because that's a medical intervention that we hear a lot about and use a lot. There currently isn't a tested vaccine for coronavirus, and actually the coronaviruses as a whole, I don't believe there ever has been a truly successful, outstandingly successful vaccine. The flu shot has an iffy success rate and there's controversy about it, but not to worry, our immune system is based on much more than just making antibodies, which is the part that is affected by vaccines. Our immune system has a huge portion of it which is called the cellular immunity side, or the humoral immunity, and it involves not only the defenses of the cell and the cell membranes, but all kinds of other substances which fight germs no matter what they are and without any antibodies involved. So that's the side of the immune system that we definitely want to enhance. The usual precautions of rest and not getting stressed out and hygiene are very important. Positive attitude is very important. We tend to dismiss those things because we just like high-tech solutions. But a happy, healthy, rested person has much more resistance to any disease, and this one is no different. Okay, moving on to what you can actually expect if you go to the doctor. If you come to our office, of course, we're not going to be able to handle hospital emergency situations, but we're going to do desensitization and rebalancing of the body so that it can fight the virus better. We have a separate video just on that technique, and you may be able to do it on yourself at home to some extent. So please check that one out. Now, I have another video on the protocol of the herbs and supplements we're recommending. This video is going to discuss what happens if it goes past that point. You've done what you can, you've avoided, you've desensitized, you've been taking the preventive supplements, and you're still getting sick. First of all, we have homeopathics, but those are specialized in use. I'm not ready to discuss them generally yet. But we also have lots and lots of herbs and supplements. One thing that we assume is that you're eating fresh vegetables and fruits and that you're getting enough vitamin C from whole food sources. If you got extremely ill, then high-dose vitamin C, such as sodium ascorbate, would be very useful. But before you actually get sick, it can actually be neutral to sometimes detrimental, because whole food sources have everything in it that your body needs to utilize that vitamin C properly. So I want to encourage you to eat high vitamin C foods, and if you have supplements such as Camu or Amla or Acerola or plant-based vitamin C's, by all means use them. Standard Process also has a Cataplex C, which is actually meat-based. Yes, there's vitamin C in the right kinds of meat. Those are all useful, and make sure you're not depleted in those areas. So, as we move on, I'm not going to explain all of these. You want to pan around with that, Tammy? These are just a portion of all of the herbs and supplements that we have available that are helpful for different phases of viral infection. Many of these are taken from Chinese medicine, and the Chinese, the traditional Oriental medicine people have a lot of experience with these nasty viruses, and they have had good success rates when they've had time to apply them. Of course, when the virus hits everybody all at once, then you have the kind of situation that China has been suffering from recently. But these are tried and true remedies, and they're also well researched. I'll post some links at the bottom of the video. So I just wanted to briefly mention a couple that are important. Many of our patients will already have Conjuplex. If you want to take one or two per day at this time for prevention, that's good. In the beginning of a viral infection, Conjuplex is excellent. Now, normally we recommend that you keep taking it. For this virus, I would say after the first couple of days, drop it down to maybe one or two, or check with your doctor. That may be one that we pull, because it encourages immune response, and at some point this virus causes problems because it stimulates an overactive immune response. Another one that many of our patients already have is Vitanox. It's excellent because it has rosemary and green tea in it, and the specific phytonutrients in these herbs have been shown to fight the virus at specific stages. Also, we use it for air pollution, which is on again, off again, a problem in our area, and it shows up right around now when they're spraying the crops. Okay, let's see. Many of our patients will already have Scutellaria, or they'll be on rosemary for other issues. Rosemary is also helpful for the virus. Berberine active is antiviral, specifically a strong antiviral. Some of you may have these things in your pantry and the pills are just sitting there. If you're not sure, you can contact our office. Astragalus complex also helps control and direct your body's immune response efficiently against the virus. We have, well, I'm not going to go over all of them, but olive leaf is one that many of our patients are already on. It's excellent because it's anti-inflammatory, and part of the problem with the virus in the later stages, if your body hasn't fought it off, is that the lungs get very inflamed and they start to fill, and it turns into sort of a really a seriously congested situation. Olive leaf can help prevent that. Many people have echinacea. Echinacea will kill viruses. However, it needs to contact them directly. So if you have an echinacea tincture, Echinacea angustifolia, and the moment you feel like you've got a little soreness or something funny going on, you can dilute it a little bit and gargle with it, or spray it in there, get it right into your body where you know the virus has gone. Do not use it in the nose. Save that for your silver. Okay, so we have many others. Elderberry is an interesting one. If you have elderberry, I would be taking that now. If you actually do contract the virus in spite of it, again, like Conjuplex, when you're a couple days in, you probably need to decrease the elderberry because of how it affects the immune response. It isn't ideal all through the virus if you've got a serious case. But for prevention, very good. Proven antiviral. Okay, see anything others? All right, well, my point is we have so many tools. And do not worry, because worry never did anybody any good. Concentrate on being positive and helping others. Now, I want to talk about one more thing on this video, and that is how coronavirus is different from the flu. When you have the flu, the worst side effect is pneumonia, and that would be especially if it's a bacterial pneumonia, and at that point you need antibiotics and possibly steroids. The coronavirus is a little trickier in the sense you get acute respiratory distress syndrome, or ARDS, and it's not a bacterial pneumonia. Antibiotics are likely useless unless your doctor is sure that you have been infected. Likewise, there's a time in the treatment of the virus where steroids may help, but they may not. So I would strongly discourage running off for a Z-Pak, because that's kind of a general shotgun approach. It may not be the right thing for this virus. If you just have the virus and it doesn't go into any sort of pneumonia situation, you're going to be okay. If you develop shortness of breath, if it's mild, you could give us a call. If it seems severe and you're having serious trouble breathing, that would be the time to think about going to ER. But again, if it's mild and something you think you can handle, I wouldn't want to overburden ER and expose myself to other sick people unless there was a very good reason for it. So let's see, I'll be posting more videos. Just stay tuned. I'll put little short ones on there to just update people as we learn more and as we gain more firsthand experience with this new challenge. Thanks.